PRS complexes. Ventricular tachycardia. In this place, patient has sync complexes with small distance between each other. It is supraventricular tachycardia. But this patient additionally has block. You need just a supraventricular tachycardia. Ventricular fibrillation, something abnormal in ECG. Wide deformed complexes plus regular rhythm. It is ventricular tachycardia. Ventricular fibrillation, something abnormal. Normal distance, short distance, pause. This one, supraventricular extrasystole. Similar. Normal, short distance, pause. Supraventricular extrasystole. This one short distance, this one long distance. We can put this one short distance twice for this pause. That's why it is cyanoatrial block. Normal, something abnormal. Normal, something abnormal. Wide deformed complex. It is ventricular extrasystole. Same. Abnormal complexes. Ventricular extrasystole. Abnormal complexes. Ventricular extrasystole. Normal, abnormal complex. Normal, abnormal. Every second construction is abnormal. Ventricular extrasystole by Geminia. Abnormal. 1, 2, normal, abnormal. 1, 2, abnormal. 1, 2, abnormal. Every third construction is extrasystole. Try Geminia of ventricular extrasystole. Normal, abnormal. By Geminia of ventricular extrasystole. M-like shape in V1, wide S-wave in V6. It is right branch bundle of Higgs block. M-like shape in V1, wide S-wave in V6. V1, V2, M shapes. It is right branch bundle of Higgs block. Very wide, deformed with small M-shaped complexes in V6. Left branch bundle of Higgs block and deep S-wave and wide S-wave in V1. Additional sign. Deformed and wide complex PRS in V6, deep S-wave and wide S-wave in V1. Left branch bundle of Higgs block. Deep S-wave in V1, V2, big R waves in V5, V6 are similar with S, some way between V4 and V5. No, wait. depressor of ST segment in these places. Elevation of ST segment in these places. Second, third, and AVF leads has elevation of ST segment. V1, V2, V3, V4 has depression of ST segment. Main pathology of this one. Patient feel pain. Patient has acute coronary syndrome. We need prescribe troponin test. If troponin test is positive, it is super-acute stage of myocardial infarction. If troponin test is negative, it is stenocardia. QS wave, negative T, ST segment close to isoelectric line. QS, isoelectric line, negative T. Subacute stage of transmural myocardial infarction of V1, V2. Anterior wall, septum, apex, and partially lateral wall. QS, negative T, QS, negative T, elevation of ST maybe, QS, negative T, subacute stage of transmural myocardial infarction in anterior wall, septum, apex, and lateral wall. Q wave, elevation of ST. Q wave, elevation of ST. AVF, Q wave, elevation of ST. Acute stage of big focal, because R wave is present, myocardial infarction of inferior wall. Second, third, and AVF. Similar, QS, elevation of ST. Q wave, elevation of ST. Q wave, elevation of ST. Acute stage of big focal myocardial infarction of the inferior wall. You can see tachycardia. QS, elevation of ST. QS, R is absent, elevation of ST. Q wave, elevation of ST, R is present. Elevation of ST, elevation of ST, elevation of ST. Patient has tachycardia. P wave is present, this sinus tachycardia plus myocardial infarction. QS, elevation of ST, is acute stage of transmural myocardial infarction of anterior wall, septum, apex, and lateral wall. Total myocardial infarction. QS, elevation of ST. QS, elevation of ST. QS, elevation of ST. Acute transmural myocardial infarction of the inferior wall. QS, ST close to isoelectric line, negative T. QS, negative T. QS, negative T. Subacute stage of myocardial infarction of the interior wall, septum, apex. QS, negative T. QS, negative T. Same, negative T. Subacute stage of myocardial infarction, transmural myocardial infarction of anterior wall, septum, apex, partially lateral wall. You can see F waves and irregular rhythm. It is atrial fibrillation. You can see big F waves. It's better to see it in V1 and in this cut. Big F waves. Atrial flutter. Rhythm is irregular. It is incorrect type of atrial flutter. irregular rhythm, and F waves.
Fibrillation.
Atrial fibrillation. You can see big F waves. It's somewhere between atrial fibrillation and the atrial flutter. It's close to atrial flutter. This one atrial flutter. You can see big F waves. Спасибо. A lot of big F waves. Atrial flutter. Big F waves. Atrial flutter too. If you will have questions about hard blocks, you will need this or this card. These three cards are similar. First one is Cyanoatrial Block. You can see normal distance, long pause, P-QRS complex disappear. Second one, M-like shape of P-wave, intra-atrial block in this case. Next one, enlargement of PQ distance. It is AV block first stage. Next one, long PQ distance. It's longer with every new construction. P still on ECG, QRS complex disappear. AV block second stage, Mobitz 1. Next one, everything is normal, then P still on ECG, QRS disappear. It is AV block, second stage, Mobitz 2. P wave has own rhythm, QRS waves, complexes has own rhythm. It is full AV block, third stage. If you will need hypertrophies of atriums, enlargement of B wave in height, it is hypertrophy of the right atrium. M-like shape of the P wave or wide deformed wide P wave, it is hypertrophy of the left atrium. M-like shape of the P wave, hypertrophy of the left atrium. This one, normal heart rhythm. This one has short distances between complexes. It is tachycardia. This one, distance longer than normal. This one, bradycardia. Similar card. Practically similar. Tachycardia, normal heart rate, bradycardia.